I've worked in emergency rooms for over 30 years, and I need you to hear me clearly. Most people over the age of 60 will not survive their first heart attack if they are alone. That's not fear-mongering, it's a fact. Nearly half of heart attack deaths happen before the patient even makes it to the hospital. Why? Because they waste time. They hesitate. They panic. They don't know the simple life-saving actions that can keep the blood flowing long enough for help to arrive. And the brutal truth is this: if you don't know these steps, you could be gone in minutes. Every day I've seen patients brought into my ER who could have lived if they had just done one or two things differently at home. A crushing chest pain, sudden shortness of breath, dizziness, a cold sweat, and by the time they get here, the golden window has slammed shut. But here is the good news. There are science-backed techniques, simple actions you can take immediately, even if you are completely alone, that can double your chances of survival. No gimmicks, no myths. These are actual strategies that cardiologists teach their patients. In this video, I will walk you through 7 vital tips every older person must know to survive a heart attack when no one else is around. These are the exact steps I wish every patient in my ER had practiced before their attack. And wait until you hear number 3. It's that powerful. Research shows it can be the difference between permanent damage and walking out of the hospital alive. Most people have no idea, but after today, you will. All the medical references and scientific studies I mention are listed in the description below. Before we dive in, here is a quick question. How old are you? Let me know in the comments. Personally, I read and respond to everyone just like a conversation in my clinic. So don't hold back. Now, without further ado, let's start with number 7 on our list. And it's the very first step that could decide whether you make it out alive. Number 7, call emergency services immediately. Do not wait. The first and most critical action when you feel the signs of a heart attack is this: call emergency services immediately. Don't wait. Don't second guess. Don't tell yourself, maybe it's just indigestion, or I'll see if it passes. Every minute you wait, the damage to your heart muscle gets worse. Cardiologists explain it in simple terms. Time is muscle. The longer the blood is blocked, the more heart cells die, and the less chance you have of walking out of the hospital alive. Research backs this up. According to the American Heart Association, patients who call emergency services within the first 5 to 10 minutes of symptoms have up to 50% higher survival rates than those who delay. Yet tragically, many older people minimize their symptoms. Studies show that almost 1/3 of people over 60 wait more than 2 hours before seeking help, often because they don't want to bother anyone or believe they can tough it out. That hesitation can be fatal. Picture this. A 68-year-old grandfather in Ohio felt an odd pressure in his chest one evening. He told himself it was probably gas, drank some water, and sat down to rest. He waited for hours, hoping it would fade. By the time his daughter found him and called 911, the damage was irreversible. Doctors told the family that if he had called emergency services immediately, he likely would have survived with minimal heart damage. That story is repeated thousands of times every year, and it is preventable. So if you are over 60 and you feel crushing chest pressure, sudden shortness of breath, unexplained nausea, or that ominous cold sweat, act as if it is a heart attack until proven otherwise. Pick up the phone and dial emergency services without hesitation. Even if it turns out to be indigestion, you've lost nothing. But if it is a heart attack, and often it is, you just took the single most important action to save your life. Recognizing the urgency and making that call is the first act of survival. But while you wait for the ambulance to arrive, what you do next can keep your blood moving and buy you even more precious minutes. That leads us to tip number 6, a proven technique to keep oxygen circulating when every second counts. Number 6, chew an aspirin if available and not allergic. Once you've called emergency services, the next step can be the difference between life and death. Chew an aspirin, don't swallow chew it. Why? Because aspirin is not just a pain reliever. It's one of the most powerful clot-busting medications you can get without a prescription. Heart attacks happen when a clot blocks blood flow to the heart muscle. Aspirin works by thinning the blood and preventing the clot from growing larger, keeping some flow going until help arrives. The science is clear. A landmark study published in The Lancet found that taking aspirin during a heart attack reduced the risk of death by 23% in patients. But here's the catch: speed matters. The faster it gets into your bloodstream, the faster it starts working. Swallowing a whole aspirin can take 10 to 12 minutes to dissolve in your stomach. Chewing it breaks it down instantly, allowing the active ingredient to be absorbed through your mouth and stomach lining in just minutes. In a situation where every second counts, those minutes can save heart muscle and save your life. A retired 70-year-old bus driver was alone in his living room when he felt that crushing chest pressure. He remembered his doctor's advice, reached for the aspirin in his cabinet, and chewed it while calling 911. Paramedics later told him that that simple action kept his blood flowing just enough to prevent major heart damage. He walked out of the hospital 2 weeks later alive and still independent. But here is where many older people make a mistake. They either don't keep aspirin in the house, or they hesitate because they are unsure if it's safe. If you have an aspirin allergy, a bleeding disorder, or if your doctor has specifically told you not to take it, then skip this step. For everyone else, keeping a bottle of non-coated aspirin in an easily accessible place is one of the smartest emergency precautions you can take. Doctors usually advise chewing one full 325 milligrams tablet at the first sign of a heart attack. Think of it this way. Chewing that pill is like sending in a rescue team to slow down the disaster until reinforcements arrive. It doesn't cure the heart attack, but it can stop the damage from spiraling out of control. Acting fast with aspirin keeps the survival odds tilted in your favor. But surviving a heart attack alone isn't just about what you take. It's also about how you move your body during those terrifying minutes. And that is where tip number 5 becomes crucial. Number 5. Loosen tight clothing and sit upright to help reduce strain on the heart. When a heart attack strikes, every move you make affects how much strain your heart has to endure. Older people often underestimate how quickly restricted circulation and poor posture can make a bad situation worse. Tight belts, waistbands, or neckties compress blood vessels and make it harder for your body to circulate oxygen-rich blood when it needs it most. Sitting upright relieves pressure on your diaphragm and lungs, which makes breathing easier and reduces the workload on your already struggling heart. Lying flat forces the heart to work harder, especially in older individuals with weaker lungs or pre-existing conditions like COPD. By sitting upright, preferably at a slight angle with back support, you improve airflow to the lungs, decrease pressure inside the chest, and allow blood to circulate more effectively. A clinical review in the European Heart Journal highlighted that positioning patients in an upright position during cardiac distress helps to reduce pulmonary congestion. Basically, the fluid buildup in the lungs that makes breathing feel like suffocating. In other words, how you position your body can literally mean the difference between gasping for air and staying calm enough to survive until help arrives. A 74-year-old woman in Florida felt chest pressure while gardening. Instead of lying down in a panic, she moved to a chair, loosened her gardening apron and waistband, and sat upright while waiting for the ambulance. Her doctor later told her that decision likely prevented her from fainting and collapsing before paramedics could give her oxygen. That small adjustment kept her heart from giving out under the strain. It's a step so simple many older people overlook it, but it's vital. If you feel those telltale signs, pressure, shortness of breath, or cold sweat, sit upright, relax your shoulders, and free your chest and waist from restriction. Think of it as giving your heart room to breathe. This adjustment buys you precious stability, but to further improve your chances, you need to ensure blood is still flowing to your brain and heart when the circulation is under attack. That brings us to tip number 4, a powerful physical action older people can take in those desperate minutes before medical help arrives. Number 4, cough forcefully if you feel faint. It can temporarily keep blood flowing to the brain. It sounds bizarre, almost too simple, but in the middle of a heart attack, coughing, yes, coughing, can sometimes keep you alive long enough for help to arrive. Doctors call it cough CPR. The principle is simple. When you cough deeply and forcefully, your chest muscles contract, your diaphragm compresses, and pressure builds up inside your chest. That pressure forces blood out of the heart and up to the brain, keeping you conscious when the circulation is failing. Now let's be clear. Cough CPR is not a substitute for medical treatment, and it's not a cure for a heart attack. But it can buy you precious seconds if you feel faint, dizzy, or about to collapse before the ambulance arrives. Research published in the Journal of the American College of Cardiology showed that repeated forceful coughing during cardiac arrhythmias kept patients conscious and temporarily maintained blood pressure until emergency treatment could be administered. In some cases, patients were able to maintain alertness for several minutes just by coughing every 2 to 3 seconds. Imagine this. A 69-year-old retired mechanic in Texas felt a sudden wave of dizziness during what turned out to be a major heart attack. Alone in his workshop, he remembered hearing about cough CPR. He started coughing forcefully over and over and remained conscious until the ambulance arrived. Doctors later said those coughs likely prevented him from collapsing and sustaining brain damage before they could restart his heart. The science is straightforward. Fainting during a heart attack is caused by a sudden drop in blood flow to the brain. By coughing forcefully, you create an artificial heartbeat, almost like squeezing a pump with your chest muscles. It's imperfect, and it won't stop the heart attack, but it keeps oxygen circulating to the brain long enough for help to take over. If you ever feel your vision narrowing, your head spinning, or your body going limp during chest pain, try this. Take a deep breath, then cough hard and deliberately, as if you are trying to clear your lungs. Repeat every 2 to 3 seconds until the dizziness passes or the ambulance arrives. Think of it as manually keeping your heart moving when it's struggling. This unusual but powerful technique has saved lives. But once you've stabilized yourself, you also need to make sure oxygen is getting into your lungs effectively. That is where tip number 3 comes into play. Another simple but vital habit every older person should master. Before we continue, if you are getting value from this video, please hit the like button and make sure to subscribe and turn on the bell icon so you never miss powerful health tips like these. Number 3, unlock your door and keep your phone close so help can reach you quickly. When a heart attack strikes, every second is precious. Not just for your body, but for the people trying to save you. One of the most overlooked survival steps is also one of the simplest: unlock your door and keep your phone within arm's reach. Here is why this is critical. Paramedics are trained to break down doors if they have to, but every extra barrier costs time, and during a heart attack, time is muscle. Studies show that for every 10-minute increment of delay in treatment, survival rates drop by nearly 10%. Imagine losing those life-saving minutes simply because help couldn't get to you fast enough. Unlocking your door beforehand removes that risk. A 73-year-old widower in Arizona learned this the hard way. He called 911 after crushing chest pain, but collapsed on the floor before he could unlock his front door. Paramedics arrived within minutes, but had to waste precious time forcing entry. By the time they reached him, too much damage had been done. Contrast that with an 80-year-old woman in Florida who unlocked her door, clutched her phone, and sat in a chair near the entrance. Paramedics got in, immediately started treatment, and rushed her to the hospital. She survived with only minor heart damage. The second half of this tip is just as critical. Always keep your phone with you, especially if you live alone. Too many older people leave their phones in another room or plugged into a charger out of reach. During a heart attack, even walking a few steps can trigger a collapse. Having your phone right beside you ensures you can stay connected with emergency responders until help arrives. Some even recommend putting your phone on speakerphone so you can follow instructions without holding it up to your ear. Think of it this way. Your phone is your lifeline, and your unlocked door is the bridge to get help to you faster. Together, they eliminate barriers and reclaim time you can't afford to lose. Once the path for help is clear, the next step is keeping your body calm enough to survive until that help arrives. And that is where tip number 2 makes all the difference. Number 2, breathe slowly and deeply to reduce stress on the heart and oxygenate the blood. In the middle of a heart attack, panic is your worst enemy. When fear takes over your body, shifts into fight or flight mode, releasing a flood of stress hormones like adrenaline. This spikes your heart rate, raises blood pressure, and forces your struggling heart to work even harder. That is why one of the simplest survival actions you can take is also one of the most powerful. Breathe slowly and deeply. Deep breathing does 2 critical things. First, it increases the amount of oxygen reaching your blood and brain, which are desperately craving fuel when circulation is limited. Second, it signals your nervous system to calm down, reducing the surge of stress hormones that put extra strain on the heart. Research published in the Journal of Cardiopulmonary Rehabilitation and Prevention found that slow, controlled breathing reduced heart rate and improved oxygen delivery even in patients with advanced cardiovascular disease. It's not a cure, but it gives your body a fighting chance while you wait for help. A 76-year-old retired nurse from Michigan described how she survived her heart attack by focusing only on her breath. As the crushing pressure in her chest mounted, she resisted the urge to panic. She sat upright, closed her eyes, and started inhaling slowly through her nose, exhaling even slower through her mouth. By the time the ambulance arrived, she was weak but still conscious. Her cardiologist later told her that those steady breaths had likely reduced her heart's workload and kept oxygen flowing to her brain long enough for treatment to begin. Here's how to do it if you find yourself alone and in danger. Place one hand on your belly, not your chest. Inhale deeply through your nose, feeling your abdomen rise. Then exhale gently through pursed lips as if you were blowing through a straw. Aim for about 6 to 8 breaths per minute, slow, controlled, and deliberate. This type of diaphragmatic breathing not only helps the heart, but also keeps your mind focused when panic wants to take over. Think of each deep breath as buying yourself more time. Time for oxygen to reach your brain, time for your heart to ease its workload, and time for the ambulance to arrive. And if there is one last habit that ties all these survival tips together, it is the final and most critical one. The action at number 1 that research shows can double your chances of survival. Number 1, stay as calm and still as possible. Movement can worsen damage during an attack. When a heart attack strikes, your first instinct might be to move pace or even try to walk it off. But that instinct can be deadly. The number 1 rule of survival is this: stay as calm and still as possible. Every step, every sudden movement forces your weakened heart to pump harder. And during a heart attack, your heart is already fighting for its life. The science explains it clearly. During a heart attack, blood flow through the coronary arteries is either blocked or significantly reduced. Movement demands more oxygen from the heart muscle. But with the supply cut off, that extra demand only increases the damage. A clinical study in the European Heart Journal showed that minimizing exertion during acute coronary events reduced complications and improved outcomes. Simply put, older people who stayed calm and still lived longer than those who moved around in a panic. A 71-year-old farmer in Nebraska learned this firsthand. While fixing equipment, he felt the crushing pressure in his chest. His first thought was to climb back up a ladder to get his phone. Instead, he forced himself to stay put and called for help right where he was. Paramedics later told him that remaining in position kept his heart from giving out under the stress. He survived with far less damage than his doctors anticipated. Calmness is not just physical, it's mental. Panic floods your body with adrenaline spiking blood pressure and exacerbating the heart attack. By focusing on staying still and practicing slow, deep breathing, you lower that hormone surge and help keep your body stable. Tell yourself, I've called for help. My only job now is to stay still and breathe. This mindset prevents rash decisions like trying to walk to the door or grab something across the room. Actions that could trigger a collapse before help arrives. Think of your heart during a heart attack like a fragile engine running on fumes. Every movement speeds up the engine and risks blowing it out. Stillness, calmness, and conserving every ounce of energy are the keys to buying time. This is the final, most powerful habit. Do less, breathe more, and let help come to you. Together, these 7 tips form a survival map. And while you can't predict when a heart attack might strike, knowing exactly how to act can be the difference between tragedy and survival. And there it is. 7 vital tips every older person must know to survive a heart attack alone. From calling emergency services immediately to chewing aspirin, loosening tight clothes, coughing. If faint, unlocking your door, slow breathing, and finally maintaining complete calm and stillness. Each action buys you precious minutes. Those minutes can mean the difference between life and death. Remember this. A heart attack doesn't always give you a second chance. But if you act fast, think clearly, and follow these steps, you can survive and live to see tomorrow. The science is clear, but it only works if you are ready to act. Now I want to hear from you. Where are you watching from? And do you keep aspirin or another emergency plan ready in your house? Drop your answer below. We read and reply to every comment because your story matters, and your survival tips could help someone else. Don't forget to like this video, share it with your loved ones, and subscribe for more life-saving advice. Stay safe, be prepared, and remember, knowledge is power, especially after the age of 60. If you have any questions or would like to share your personal experience, don't hesitate to leave a comment below. We are always listening. Thanks for watching.